What are the stories of impact and ingenuity that are transforming our cities? Join us on the Urban Q, where we talk about tackling urban conundrums and celebrate stories, ideas, and people that help us create better cities for all. Hello, everyone, and welcome to the Urban Q. Today I have with me Dr. Nachiket Mor. Nachiket is a thinker in health systems design and financial systems, currently serving as the visiting scientist at the Banyan Academy of Leadership in Mental Health and a visiting professor at the Indian School of Business. Through his research and as commissioner on the Lancet Commission on Reimagining India's Health System, he hopes to eventually shape the national dialogue around good health and well being for all Indians. He has served on various government health task forces, was involved in building a pioneering rural primary care model in Tamil Nadu, and has previously led the Bill and Melinda Gates Foundation's India Country Office as its director. He has also held board level positions at the RBI, NABARD, ICICI, and other financial sector organizations with a focus on advancing the development of the financial sector in India. Welcome, Nachiket, and thank you for joining us on our podcast, The Urban Q.
Very happy to be here. Thank you for having me.
All right, so Nachiket, I want to start with the first question I ask all my guests about their favorite city. So your work and various associations have taken you across the rural and urban sort of landscapes in India. And of all the places you've worked in, is there a city that especially appeals to you and why?
Not really. Each city has its own charm. I've lived in Bombay, Delhi, Chennai, Nagpur. But I would say I prefer smaller, more local environments, sometimes in a big city or sometimes in a smaller town, to large metropolises that seem somewhat impersonal.
That's interesting. Smaller cities as a better destination sometimes. That's very interesting. Now coming to sort of some of the work that you're doing with respect to health, you've described health as both relational and place-based. And in cities, when we talk about good health, we often cite, the Kerala model and focus on the provision of healthcare centers, facilities, and services. But according to you, what other parts of the city system are just as important in shaping health outcomes, especially mental health?
I mean, let's stay with the Kerala example that you just gave. They have what one would argue would be one of the better healthcare delivery systems, but they also have the highest diabetes burden in the country. Part of the reason is that if you go to any Kerala city today, Kochi is a city that I've been to often. It's a lovely, beautiful, historic city, but there's nowhere to walk. There are no sidewalks. They do have a reasonable public transport, but they haven't really built a city for good health. Clearly, quite important. Cities like Bombay that have done work in rehabilitating slums. So they've taken care of some aspects of poor health, including mental health that can come from crowding, from poor housing. But they've then built buildings that are cheek by jowl next to each other with no ventilation, and therefore created a whole new burden of tuberculosis that actually can be dealt with only with a much better building code and not really with healthcare.
So that's very interesting because when you think about health systems, and you've talked about the value of systems thinking, how can we use that approach? Because, the way a city is designed is connected also to your health outcomes. There's the preventative versus, the reactive approaches to how you address health and all of that. But how do you use a systems approach to improve health and well-being of urban dwellers today? So, and how can this approach, help us better understand and address sort of these complex urban challenges? Because housing, where you live, is connected to, how you travel to your workplace, is connected to, health outcomes, climate events that we keep seeing around us. They're all interlinked. So, how do we think about a systems approach to solving this problem?
The reality is that healthcare is clearly an important part of the overall system, but that comes only towards the end. We have two sets of opportunities, to my mind, when we think of India and the urban spaces. There are many states today, like Chhattisgarh, Bihar, UP, Jharkhand, that have not urbanized yet. For them, urbanization is still 10, 20, 30 years. Can they use some of the best principles of transportation design, for example, of play areas, of green spaces, of handling noise pollution, and build cities that are, in a sense, not quite the modern cities that we are thinking about with big cars and big roads, but much more cities that are, local, that have smaller communities and are much more walkable public transportation based. In the larger cities, which have already been built, think of the opportunity of um, doing more with non-healthcare related systems as like a free lunch. If, for example, you're worried about mental health of children, why not think about play streets? Take a street that's not very busy during the day, close it off, give the local resident welfare association some plastic slides, plastic toys, and make that a play area for children. You don't have to wait to create a new green park. Clearly thinking about public transportation. Why are we taking these big cities and creating more and more bigger roads for bigger cars to speed down highways? Why not really focus on bus rapid transit and mass transit as mechanisms, and then focus on sidewalks? Sidewalks have not been built, which means people are not walking, which means you see a lot more two-wheeler traffic, which then has related accidents, which has a number of public health issues that come up. So I would say opportunities on both sides for large cities and the newer, smaller cities that we.
Oh, that's fantastic, and I really like this idea of the place-based approach and sort of building more humane, local and people-centered places. And the point that you're talking about, building the right kind of sidewalks, play areas, and all of that, those are services, that you expect cities to provide. And our cities, as we know, are growing quite rapidly with urban population, which is expected to, go more than double by 2050, right? And in terms of service delivery, we are not doing well at all, whether it's small cities or big cities. Usually the approaches or, the fixes are short term. So where do you see are the biggest opportunities for change when it comes to moving from these short term stopgap fixes to more long term systems?
I think, and something we spoke about last time we met, we first have to work with the political imagination. My fear a little bit, let me give you an example. If I look at the disease burden of India, regional disease burden, surprisingly, some of the healthiest states are not Kerala and Tamil Nadu. They, in fact, have the highest burdens of diabetes and hypertension. Some of the healthiest states are in the north. Rajasthan, for example, is a state that has the least amount of diabetes, the least amount of hypertension, the lowest burden of cancer in the country. Now, obviously, that state in part has that because incomes are still, growing in that state. The question is, what are politicians thinking about when they are thinking about the development of that state? Are they imagining Jaipur to become like another Bombay, or do they have another vision that will prevent all of these diseases that come with a poorly designed development approach to cities to something that produces much more frugal walking? These are current lifestyles of this. How can we preserve these lifestyles? Does the political imagination see that pathway? Or do they see the pathway only via big roads and highways and flyovers?
No, that's a very important point, and a related point when it comes to political imagination is also how we are building our institutions to reimagine things differently and to deliver things differently. And you've talked about, building cities to fit our culture. So if we want our cities to be healthier and work better for everyone in the long term, what kind of, besides this whole political reimagination, what kind of institutional culture should we be building across, sectors and stakeholders, whether it's government, civil society, or businesses?
I think whatever little I understand about urban development, what has worked well in our smaller towns and villages by default, not by design, have been mixed income housing. People from different classes and communities. And I'm not saying the villages don't have a caste bias and don't have other issues, but there is a relative proximity to many of these communities. I think that's an important part of the way we are as social beings, as people that interact with each other frequently, that we need to preserve as we move towards larger cities and larger, urban spaces. This produces a number of positive effects for children when they grow up together, for job creation for people from different economic strata. But what that means then is that we have to understand how do we prevent islands like Nariman Point from emerging in the newer cities that we built. What is our property taxation approach, for example? How are we making sure that we are able to allow affordable housing to come through for people that want to live next to each other without these astronomical rents? And you only have to visit one of the famous U.S. cities, Seattle, San Francisco, New York, to see how a very rich, developed society has produced so much homelessness. Because they haven't thought through this issue of how do you make things affordable for this large community that will come together. And I think that's going to be quite important. I think it's also very important. I was a member of the Ishar Ahluwalia report committee for urban infrastructure, and we explicitly made it a point to think about, not building sterile spaces. What about performing arts? What about public art spaces? What about an opportunity for cultures to both, um, continue to engage the identities they had before they came, but also build new ones through gatherings, through community. Otherwise, you see row upon row of mega housing complexes, 5,000 flats, 10,000 flats, but really, you don't know who your neighbor is, you don't know who anybody else is, and there's no opportunity to build community.
And that's interesting. And in your opinion, just to build on that, what is the role that you think private sector needs to play here?
I mean, clearly there is an opportunity on the housing side, where you start to think about much more intelligent designs. You are thinking about climate change. Clearly, that's an important issue. If I look at, for example, developers in Bombay today, I would recommend to them that they don't treat the slum housing as some, backyard that they just push people into so that they can build fancy housing for everybody else. The experience of COVID has told us that we don't live as islands in. And what the disease that happens because you didn't actually provide people with the space that they need, the light they need, the air they need, transmits quickly to people that you felt were immune from it because they had built an enclave for themselves in a gated community. I think that's an important role and the benefit of an urban environment relative to a rural environment is that you have much higher population density, you have much more accessibility. While in the rural areas, one would imagine building healthcare infrastructure is something the government really needs to take the leadership role in. There isn't enough revenue potential for the private sector to enter. Right. But in an urban area, why wouldn't you build a fully what we call regulated competition or managed care in which primary, secondary, tertiary care is available at a high quality in a neighborhood so that you're not only building large, glass-plated hospitals, but you're thinking about the entire environment. It's good business and it is good health. Again, something that the private sector can do, much more effectively in an urban environment than in a rural.
And coming back to your point on inclusion that you touched a little while ago, right? So when we're talking about climate risks and as they're intensifying in cities, especially in the ways in which we are experiencing them, and the ways in which low-income communities are experiencing them, how do you see the role of financial inclusion, whether it's things like micro insurance or credit systems in building urban resilience? What kind of financial innovations do we need to protect the most vulnerable in our cities?
The reality today is that for a variety of reasons, good and bad, we have really not built an inclusive financial system. There was a report that was done by, Ramesh Ramanathan and Swati, in which they looked at urban exclusion right in the heart of the city of Bangalore. And what you find is that many, many, many small merchants have no access to it. Now you might say, what does that mean? Why is that important? Because if you don't give access to it, you do not allow growth, you do not allow consolidation. You have these people live in the sidelines. They don't have the wherewithal to follow sanitation guidelines. They don't have the wherewithal to provide insurance to their workers, and they're not able to then cascade this idea of prosperity, good housing, to a larger community in which they are living, because they themselves have no access to the ability to grow. So, a vibrant economy like Bangalore or Bombay, there's no reason why there should not be much more ubiquitous access to savings products, insurance product, diversification products, investment products. Today, we have built such big barriers of cost, access, that if you were a poor person and said, I hear that the rich people are making a lot of money in the index fund, and I want to open a mutual fund account because Sachin Tendulkar has said, yahi hai sahi, I have 100 rupees. God help me, nobody will open a mutual fund account. Insurance is the same story. I don't have the ability to access the kind of insurance products that I want, which means, if I'm an economist by training, and, if I look at core economic principles of what they call arrow-deblue complete markets, in which what I can do is design a life that is best suited to my capacities and my preferences. I can't do that because I don't have all of the instruments of savings, insurance, to create, all of what I need. A lot of people are doing temporary migration. They're going back and forth at enormous cost to themselves, enormous cost to their families. And why? Because they can't get housing here. They don't have financial products needed to, access good housing for themselves and their families. And I think that clearly hurts their resilience. And then you add on top of that all of the climate-induced uncertainties, diseases, that will emerge. You then compound with them.
But you're saying it can be done. It's just that we haven't paid attention to it. We're not focusing our attention there, but it can be done.
See, in healthcare, I think there are fundamental barriers that we have. We haven't really thought through all of the ways in which healthcare needs to be organized. And there is, even for me personally, a learning journey ahead before I can make any strong statements. But in finance, we have built, unarguably, one of the best modern financial systems in the world. We have all of the banking services needed, all of the automation needed, all of it. I would go further than to say that if we are not doing it, it's because we don't want to do it. It's not even that we are neglecting it, because it's staring at us. I can pretend I don't see rural poverty because I don't go there every day. But I cannot pretend that I walk around the streets of my city and I don't see people that could grow, that have all the energy and the vitality, but I'm not prepared to build structures that allow them to gain.
You're right. We have to speak up and hope the right people are listening and paying attention and pay heed to what is being said. This has been fascinating, Nachiket. Coming to the last question that I really want to ask you is about, what lessons from your work in rural health systems, for example, could urban governance and planning systems draw from? What are some of the lessons that you'd like to share?
See, often, I saw this in the financial sector, I see this in the healthcare sector. A lot of our narratives are weakness based. They are based on this is the problem, that's a problem, and oh my God, what are we going to do? We actually don't think as much about what the opportunities there are, what strengths do we have of them. Unemployment is an enormous problem. We can stare at that and wring our hands and say, what's happening here? Or alternately, say, can I build a health system that actually serves every individual at their home with the benefit of these very unemployed people who will now get a job and the training that they need to go door to door? In a rural environment, it is harder to do because the door to door means a lot more travel, a lot more distances. In an urban area, it's a lot more dense, a lot more concentrated. There is no reason why we should be seeing, such high levels of malnutrition in a city like Bangalore, in a suburb of Bangalore, a part of Bangalore called Koramangala. I see numbers that are just mind-boggling. No reason why they should be there. We have learned from rural work that if you engage people with community members, you can actually make this. And the beauty of all of that is we can do this at costs that are very affordable to us, that can help us build a system, ideally financed by the government. But even if not financed by the government, in the private sector steps, that people can afford, people can actually feel that it is something that that they can access, and which is why a thoughtful, directed approach would be needed. But there are clearly opportunities for us to do this. We have many migrants. I understand from the experience of some of the NGOs working on the ground here in Bangalore that even basic skills like breastfeeding, what you learn from your mother, what you learn from your mother-in-law, women have to figure out themselves. And it's part of the reason why the baby becomes malnourished, because actually not all mothers are able to figure it out because they don't have the kind of hand-holding support they would have had in their village. What prevents us from building community-based cadres that actually are comprised of middle-aged, older women that have deep experience of all this? They go there and make things happen. These are all opportunities for us that I think we can, and then we can combine that with the best of the best technologies. Because in a rural area, that would mean a 4-hour ride. In an urban area, that's a 15-minute ambulance ride. But we need to then figure out what you said earlier. What is the insurance model? How do we finance this so that the very poor can access the same quality of care that anybody else with higher incomes is able to?
Well, that's brilliant. And Nachiket, thank you so much for connecting the dots across so many different systems for us, and for the very important work that you're doing on shining the light on human health and well-being in general. Wish you the very best in making many more strides in this space. And thanks again for that very insightful conversation.
No, thank you very much for having me here. And I know that your work at WRI is very, very important. And all the very best wishes to you in that work. Thank you very much.